A local doctor's medical study is drawing a lot of attention over the link between a patient's diagnosis 8 years ago and the hundreds of lung illnesses now associated with vaping across the country. Only on 12 tonight, Fox 12's Brenna Kelly spoke with that doctor who discovered the first reported case of vaping-related pneumonia in the United States.
The case involved a 42-year-old woman treated right in Portland at Good Samaritan Hospital for something called lipoid pneumonia. It's essentially oil in a patient's lungs, and it was the first reported case in which doctors hypothesized there may be a link to vaping.
It's an unregulated industry right now, and so we don't know what's in the vaping juice.
Over a month ago, the CDC launched a multi-state investigation into the now hundreds of lung illnesses associated with vaping. Many of these patients are battling lipoid pneumonia, which occurs when oil enters the lungs. But it isn't the first time doctors have seen cases like these.
The first case in the country that was reported came out of Good Samaritan Hospital.
Dr. Catherine Markin is a pulmonologist at Legacy Health. She and two of her colleagues authored a study in 2012 involving a 42-year-old woman who was hospitalized for respiratory failure.
And the only association that we could find was the vaping, and she was vaping the usual vape juice that had glycerin in it. And so we hypothesized at the time that it was associated, her hypoxic respiratory failure was associated with her vaping.
It was the first reported case of vaping-related pneumonia. Markin believes there's been such an overwhelming increase in lung illnesses, partly because vaping has become more popular and also because physicians are recognizing it.
I think there really is truly something different out there, because otherwise I don't think we would see this tremendous increase in cases being reported.
Officials haven't been able to narrow down any one substance causing these lung disease cases. The FDA says many of the samples they've tested contain significant amounts of vitamin E acetate. Markin found glycerin in her case study, which is more commonly used, she says, and comes from vegetable fat. Both are used to thicken the vaping juice. Even with her research and the recent investigation, Markin says they still don't know the long-term effects of vaping.
Well, I'm actually pretty excited that there's a lot of attention, and so I'm very hopeful that things are going to happen.
The CDC announced today an updated number of lung disease cases associated with e-cigarette use. 380 people have developed a breathing illness. The number of people who have died remains at 6, including one in Oregon. The CDC says they expect those numbers to rise. Reporting in studio, Brenna Kelly, Fox 12 Oregon.